Hi, it's Kristen, and my research question for my final paper is how will new medical practices and procedures provide the greatest contingency of the detection of HIV and AIDS in dental practice? So what is HIV and AIDS? So HIV stands for Human Immunodeficiency Virus, which means that the virus enters the body and attacks CD4 cells, which are main components of the immune system. As the virus progresses, these CD4 cells are destroyed, and the immune system is completely weakened so that the body cannot fight off infections, from something as simple as the common cold to more severe things such as cancer. So AIDS stands for Acquired Immunodeficiency Syndrome, and is the last step in the development of HIV. Not everyone that has HIV develops AIDS, and AIDS is formally diagnosed with a quantitative measurement of less than 200 CD4 cells per milliliter of blood. There are medications that treat both HIV and AIDS. Someone with HIV who is treated with medication can live just as long as the average person. However, untreated patients can die within 3 years. So who is affected by HIV and AIDS? So more than 1.2 million people in the US are living with HIV, and 1 out of 8 people don't even know that they have it. From 2005 to 2014, the number of HIV diagnoses went down by 19%, and typically gay and bisexual men, particularly young African Americans, are most affected by HIV and AIDS. However, anyone can receive the virus. It is not exclusive to that group. So what is the role of HIV and AIDS in dental care? So infection with HIV predisposes people to certain oral health problems. They can receive routine dental care. However, careful medical histories can capture insight about patients to help identify those who require special treatment plans adapted to their medical conditions. What ethical questions arise in the treatment of affected patients, and why should we care? So because of the increased risk of complications, dental treatment of patients with HIV and AIDS must be modified, and this can be costly depending on the type of oral care. However, dentists may detect oral lesions and refuse to treat patients because of their illness, and this is only progressing the disease. It's not helping the patients because they already have these dental complications and they are not being treated properly. So why did I choose to study this topic? So I chose this topic because I plan on attending dental school, and I want to be educated in modern ethical issues in the field. I feel that this subject is very controversial and can be a key topic of discussion in interviews and discussions with other aspiring dentists. When I become a dentist, I want to have a firm background in the condition of my patients, and this research paper is an early start for me. My first source comes from the NYU College of Dentistry in a publication from their Communications Committee discussing a grant for the development of a new assay. It is expected that this assay will take under an hour to complete, will be very cost effective, and thus will be widely available. The test uses gel electrophoresis to isolate and amplify nucleic acids to determine if the virus is coding for RNA in affected cells. I believe this source will be helpful in my research paper because it discusses the development of new tests in the detection of HIV and AIDS. It also discusses how cost-effective and available tests can contribute to the wider detection of HIV and AIDS around the world, and why this is a pressing issue. My second source comes from a relatively short article published in AIDS Weekly, which addresses increased rates of tooth decay and other dental deteriorations in men diagnosed with HIV and AIDS. The print argues that occasionally dentists may spot recognizable signs of tooth decay related to the virus and may refuse to treat a patient even without formal testing. There are statistics from a study at the University of Health Sciences which support this argument both in the medical field and the ethical field. The article resolves that all dental professionals must acquire adequate awareness before continuing their practice so that infected individuals may be properly treated. So this source will greatly help my paper because it discusses both the medical and ethical dilemmas that arise in the dental treatment of those with HIV and AIDS. Factual evidence from a formal study will not only support my argument of the medical precautions taken in dental care, but it will also allow me to incorporate some key terms in relation to the social stigma. I can assume that this article may serve as a bridge between radically social and profusely medical aspects of my paper, helping me form an overarching argument in both extremes. My final source comes from the Journal of the American Dental Association Landmark Series, and it discusses the defining aspects of the HIV and AIDS epidemic and how dental care may be used to treat and detect the disease. It begins by describing statistics surrounding the diagnosis of the virus, the definitive general and dental symptoms, and the biological factors and components that stimulate the spread of the virus throughout the body. Scholars who wrote the article continue to highlight the current training of dental students and dentists regarding the detection of specific oral manifestations of HIV and AIDS, such as papillomavirus and reduced cancers. They argue that modern technologies, including a cost-effective 20-minute HIV oral fluids assay, contribute to the identification of the virus in dental settings versus lengthy and expensive tests in medical offices. Overall, the doctors who wrote the article conclude that dental recognition combined with medical recognition leads to the most insightful and accurate discovery of HIV and AIDS in an individual, allowing ample time to treat the virus and reduce the risk of further infection. This source will be extremely helpful in my paper as it defines HIV and AIDS and its dental implications and relates it to dental practice and possible methods for treatment. I particularly like how the authors of the article argue that the combination of dental and medical practices will lead to the greatest contingency of the detection of HIV and AIDS in patients. After analyzing all three sources and researching the background of the subject, I can formulate my thesis, which states, dentists can most accurately detect HIV and AIDS through the combination of cost-effective, accessible assays and precise screenings invoking both dental and medical procedures.